Good afternoon. My name is Valerie Mattison Brown, and I'm the Chief Strategy Officer for the Veterans Health Administration. We're so excited to be hosting the Forging a Healthier Future Post-Pandemic Care panel. As everyone is aware, the COVID-19 pandemic has led to sweeping changes across the healthcare environment, challenging us to reimagine a post-pandemic world at both the individual as well as population levels. COVID-19 has widened the access to care gap for vulnerable populations. It's deepened the food insecurities and has increased the spotlight on the enduring inequities that exist within healthcare. In addition, we've seen providers and frontline staff face extensive hardships throughout the pandemic. But despite this, we're ready to face these challenges. It's crucial that we have conversations about the pandemic, reframing it as an inflection point. We can also look back at the obstacles that we've overcome and use them to our advantage as we strive to improve the future of healthcare. We will use this opportunity today to identify the weaknesses and inequities that exist in this field and really propel healthcare forward to create a better prepared future. Discussions like we'll have today will allow us to shift our strategy from being reactive to being preventive. Now, this panel brings leaders from within VA and the larger healthcare industry to discuss what healthcare looks like and what's termed our new normal. And following the VHA Strategic Planning Summit from June of 2021, today's conversations will also supplement and amplifying our ongoing strategic discussions on the future direction of VHA healthcare, which ultimately moves us towards increased access and improved outcomes for our veteran patients. Now, over the last several years, innovation in healthcare has really flourished. Digital health capabilities within our VA system have extended the reach to our providers and staff. And we look to a future where these innovations further benefit veterans. But to do this, we must determine the optimal blend of digital services and in-person healthcare services that positively impact patients in our organizations. Now, in doing so, we can highlight inequities in access and discuss how digital health can be the solution. We believe that ideas coming from this panel will improve our current care models and really, again, impact the future of healthcare. Now, we'd like to thank you all really for all of your flexibility and for participating in our virtual format. I'll now turn it over to our moderator, Bryn Cole. Bryn.
Thank you so much, Valerie, and welcome everyone. I am Bryn Cole. I work within the VHA innovation ecosystem, and we are so pleased to be here with you all today. Before I get the panelists on board to introduce themselves, just briefly wanted to acclimate you to my role within the innovation ecosystem. I've most recently been serving as the Director of Programming with the VHA Innovators Network, and this year have been provided with the opportunity to do design and innovation related to the pandemic with a new initiative known as Reimagining Veteran Healthcare, which really is looking to leverage the pandemic as an inflection point to reimagine how we provide value and services to our veterans. So because of that, I have the distinct honor of meeting with our panelists today and want to encourage all of you as you're watching to bring up any questions that you have in the chat as we go along. We'll be there monitoring and we'll be very happy to respond to you as your questions pop up. But for now, let's kick it off by first getting to know our panelists. I'm going to go around the horn a little bit, invite each of you to introduce yourselves, a bit about your background, both professionally and personally, a bit about who you are as a human, and then we'll get to the task at hand. So let's start with John Bursler.
Good afternoon, howdy. Thanks so much for having me. And my name is John Bursler, and I currently serve as the Chief Experience Officer here at VA. And we're responsible really for the enterprise-wide application of customer experience tools and implementation to make sure that VA is a world-class customer experience, or provides that world-class customer experience to our veterans, families, caregivers, and survivors. I come from a technology background in particular, and how to design around or for veterans and families and accessing the social determinants of health that lead to better health and economic outcomes for them and their families. So it's great to be a part of the VA team. And in terms of me personally, I'm a Marine Corps veteran, and they always say that Marines have the best self-deprecating humor. But the funny thing is that we don't really know what self-deprecating really means. So back over.
Great. Thank you so much for that, John. I'm really excited to bring you to the wider VA audience that we have today. Your work, your story, everything that you're doing is really important and is really interesting, and we're excited to highlight that. So next up, let's go with our other John Singer. Tell us a little bit about who you are, what you do, and what interests you might have.
What interest that I might have, that's a big question. I'll do the best that I can in the intro. Hello, everybody, and thank you for having me speak. I'm very much looking forward to the conversation. I'll start by guessing that I'm probably going to be a bit of an outlier with my perspective. I'm the executive director of Blue Spoon Consulting, and we specialize in the strategy and innovation at a system level, and primarily working with industry. And help them do, as you sort of touched on, Bryn, is understanding the corona pandemic as an inflection point, and helping them understand how they can reshape their market strategies, their commercial strategies. And a big part of that is how can industry collaborate with government and develop entirely new systems of engagement. I am a veteran. I spent 4 years in the Army, in the infantry. And then my personal history, though, I guess would go back to I'm a farm boy. So I was raised on a farm in Minnesota, and happy that I am currently not there, in anticipation of the winter that I know is coming and is not going to be enjoyable.
Wonderful. Thank you for that, John. And I have to say, as a kid from rural Vermont, grew up on a small family farm, who now lives back in Vermont and is getting ready for the winter, I am happy for you as well. So next, I'm going to turn it over to Dr. Rob Califf to say hello to everyone. Tell us a bit about your current work, your backstory, and anything else you might want to share.
Well, thanks, and it's good to be here. Howdy, everybody. I'm a native of South Carolina, and had spent most of my career as a practicing cardiologist who got interested in how we know whether what we're doing is the right thing, and got very involved in the use of computing and understanding the natural history of disease, and then eventually interventions and global clinical trials. That ultimately led to a stint as FDA commissioner at the end of the Obama administration. And after the election, I was out of a job, and I ended up going to Alphabet, splitting my time between Google Health and Verily Life Sciences, which are two of the subsidiaries of Alphabet. So still really pretty much working on the same thing, trying to understand biomedicine and health outcomes from a broad perspective, but now with the ability to compute at a scale I never would have imagined back in 1975 when I started with this.
Yeah, thank you so much for that, Dr. Califf. When you put it that way, I can only imagine if you were to go back into your old records, your old research from the 70s, what it might look like from now, that is what got us where we are. So thank you for that. And I have to say, this panel, I've got one more person to introduce. I'm already getting just really excited to tap into this collective group wisdom to talk about post-pandemic care. Next up, we have Dr. Sarab Bhatnagar, and Sarab is an amazing friend of the VA and the VHA innovation ecosystem, and would love to hear a bit about your background, your career trajectory, and what you're up to these days.
Thanks so much, Bryn, for having me, and thanks so much, VA, for having me. It's always good to come back and collaborate with folks from the Veterans Health Administration and Department of Veterans Affairs. My background, so I actually, similar to some of the other folks, have this intersection of technology and healthcare. Bryn, I love how you mentioned design thinking and human-centered design. My first career before becoming a physician was a user experience user designer and doing computer science and software programming. And so starting with that, then going to medical school, becoming a physical medicine and rehab physician, I've long loved the intersection of healthcare and technology. And as I often tell folks, I just thought I was just going to be a smarter chief technology officer buying CT scanners. And then over the last 15 to 20 years, this whole digital health ecosystem really emerged and exploded in the American healthcare and frankly, the global healthcare ecosystem. So it's a pleasure for me because this is the intersection of healthcare and technology that I love to spend time in. Currently, I'm the chief health officer at a company called Commure, and where we're working with large health systems, large payers, large academic institutions to really think about how do patients' journeys become a little bit easier, and really the data that underlies that, and how do you really unlock that data, not just from a healthcare perspective, meaning the clinical record perspective, but all these other elements of data that need to come together for true personalization of that patient journey or that veteran journey or that member journey, depending on your point of view. And so that's what I'm excited to work on, and that's what makes me tick. And I'm always jazzed to come back here and talk to my colleagues at the VA. And I've really loved being an outsider the last several years, continuing to see the innovation ecosystem continuing to grow and expand at such an exponential pace. I know it's a pivotal piece for how the VA serves veterans and that veteran experience that John was mentioning in his opening as well.
Yeah, wonderful. Thank you so much, Sarah. We're so glad to have you. And you bring up a lot of really important points, intersectionality, the rapid pace at which things have been moving, across decades, and then the past year and a half, which is what we're really here to talk about. So this panel looking at, forging a healthier future post-pandemic care. I first want to start by saying it's a little bit hard right now in this moment to even be thinking about post-pandemic care. So just really sort of recognize that and talk a bit about the impacts that you all have seen both personally and professionally due to the COVID-19 pandemic. And Dr. Califf, I'd actually like to start with you and really sort of understanding what have you seen over the past year and a half? What have you experienced in the impacts of the pandemic?
Well, it's hard to be brief about this, but I'll do my best. And you can imagine at Alphabet, we reach around 4 billion people a month around the world. And so with all of our information sources, we're getting constant feedback. So very early on in the pandemic, you could see this coming. It took me back to my days as FDA commissioner, where we had a playbook for things that should happen in a pandemic. And unfortunately, I got to watch the whole thing unfold in the US, where the playbook essentially was not much attention was paid to it. And I think we paid a big price for this, with an enormous loss of life and much disability to go along with it. But of course, it's not just in the US, there's a global enormous impact on the world. But I'd also add that the chronic diseases that have been plaguing us for a while now have continued on, worsened in many ways by the combination of people not seeking healthcare for fear of being in an institution or a clinic where they might get the virus, and just the fact that many people were sort of locked away and not able to keep up with their needs for things like screening, et cetera. And so if we look at just the U.S. perspective from the perch that I've had, what we see is that we were already in last place among economic high-income countries. Out of the 18 top countries, we have had the shortest life expectancy. That trend towards worsening relative to other high-income countries has been there for a decade, but it took a sharp dive over the last year and a half. So we now have about an estimated 4.5-year shorter life expectancy. And if we look at the total number of deaths, heart disease and cancer still were more than COVID, even during the peak of the pandemic so far. So, this has had an impact, obviously, on everybody. As someone who works in a data system, which is probably unparalleled in the history of the world, you can see this impact. But I think we're going to talk about today, there are a lot of bright signs for things that we can do. We have the technology is not the issue. We got the technology. The question is, how do we put it to use to solve these problems that are so evident?
Thanks for that, Dr. Califf. I mean, you're absolutely right. The bright spots can only sort of come about because of the darkness. And I want to turn it over to John Bursler a bit to talk about, your work leveraging, design thinking, especially overseas with veterans organizations. I'm curious, what do you see as being those bright spots, or even those areas that have been less bright that we need to, or that VEO is already looking at as areas for true transformation?
Yeah, thanks so much. So there are a few bright spots, I think, from the perspective of the customer experience here at VA, and with many of our partners that we've seen both in the private and other public health systems, but also with a lot of the nonprofit organizations that we work with to address a lot of those health-related social needs, like food insecurity or legal services or financial assistance or employment, that all became very important during the pandemic. So one thing that we had to switch to immediately is what we're doing right now is going to the virtual world, and VA pivoted incredibly well in March of 2020. Shifting the most of the workforce to not only the virtual world outside of the clinical ecosystem, of course, but also making sure that we can deliver telehealth appointments. And you saw kind of record numbers of telehealth appointments, and still many of those outpatient appointments are still delivered via telehealth, and it's quite effective, not only for VA and safer for VA employees and staff and clinicians, but also safer and easier for the customer. We saw a dip initially in customer experience scoring on telehealth, because I think everyone's trying to figure it out on utilizing the technology, accessing it, getting the hardware and the broadband access needed. And then over time, we've seen an increase in trust in telehealth scores for the Veterans Health Administration and the outpatient clinical services specifically. And one thing that I wanted to note is that we see among demographically speaking, women veterans trust telehealth services more than male veterans on the whole. And that trend has continued over time. And as the age groups break down, you're actually seeing more older veterans or veterans over 50 trust telehealth services more than younger veterans, which you would think that younger veterans are more, kind of amenable to technology in the digital world. So quite interesting, and something that then creates opportunities for us to improve for those customer types. And in terms of the deployment of vaccinations, that VA has done an incredible job at, and many of you should be incredibly proud of the deployment of these vaccines for veterans and their families, caregivers, and survivors. It enabled us to acquire a whole new group of customers that had never interacted with VA before, which I think is an incredible opportunity, and to not only acquire these customers, but then gauge their experience. And by and large, we see in the 90th percentile on, was it easy to get my appointment? Was the vaccine delivered effectively? Did I trust VA to continue to deliver future vaccines if we need boosters, which now we understand we will for most cases. So I think that's an incredible opportunity to not only acquire these customers, but retain these customers over time. And in particular, those younger veterans that trust us a whole lot less than their older counterparts, which is something interesting that I found here at VA. So in terms of increasing access and improving outcomes, as Valerie mentioned before, which is our kind of our North Star with Secretary McDonough, I think, that we have learned so much during the pandemic that, like you said, it bright spots that have come from the pain points that we heard about a second ago. So thanks, and looking forward to continuing the conversation.
Yeah, that is such a great point. It has been fascinating to witness the sheer expansion and activation of the VA's fourth mission, right? Being the nation's backup healthcare system in response to vaccinations, in response to opening beds for civilians and taking care of non-veterans during this massive crisis. And it really does show a very fascinating area for the VA to consider, reimagining. So I love that you brought that up. Thank you for that. John also brought up a really great point in talking about, partnerships. And John Singer with Blue Spoon, you were talking about how you do a lot of work with industry. And I'm curious what you might say about how partnerships throughout the pandemic and beyond have really been a key enabler of connecting people with and or organizations with the resources they need, the expertise they need, and really how partnerships can help propel us forward and in and out of this pandemic.
That's a great question, and I think it requires sort of a nuanced answer. And as I mentioned, I'm sort of coming at it from the industry perspective, and that's primarily the pharmaceutical industry. And part of the challenge in general when you're working with the pharmaceutical industry is that they're very market driven. And so concepts of partnership and concepts of value and concept of outcomes are very important, but have to be framed and positioned within a context of how is that going to be able to deliver business value. And that's the challenge. And they recognize that they need to sort of reorient their thinking and are working through the processes to do that. In general, it's sort of surfacing around this concept of ecosystems, not as an ecosystem that is currently out there necessarily, but as one that can be designed and then managed for continuous health engagement. And the role of partnerships is critical to make that happen. They recognize that nobody can do things alone. And so a big part of that is understanding how they can assume leadership around keystone strategy and how they can collaborate with various players across the board in being able to shape and drive completely different storylines of value. John mentioned around retaining the customers over time. I think that one of the things that's come out of the pandemic is this need to begin working with different concepts, and continuous health engagement is one of those. And that's a big concept that I think most organizations, industry, nonprofit, whoever are struggling with, is how do you maintain continuous health engagement over an extended period of time? How are the economics oriented to enable and reward that? And then you're going to get into a conversation around fee for service and whatnot. But it really is, I think, trying to work with completely different sorts of concepts and building out fluency in systems thinking as sort of the path and the frame to begin shaping different sorts of strategies that are organized on outcomes as opposed to inputs.
Yeah, John, that is fascinating. And I can definitely appreciate the nuance needed. I'm sure it's even more nuanced than that. You bring to mind some ideas of how the pandemic may have really shaken up some orthodoxies that have been deeply held across healthcare industries. And we'll get to that. So I'm going to tuck that in our back pocket for now, but thank you. Saurabh, I'm curious, from your perspective, I want to bring that partnership question back. You have a different sort of lens that you bring to that conversation. What have you seen about related to how partnerships have been or could be the answer to helping to solve some of the problems that we've seen?
Yeah, that's a great question, Bryn. So with what we've seen, and this was occurring before the pandemic, or even before February, March of 2020. But what we really saw an acceleration of is that there's more digital health, more healthcare technology that is being spawned in the United States, and then also, frankly, globally. Like the numbers of digital health companies are nearing, I think, over 4,000 now. So as even Dr. Califf mentioned a little bit earlier, chronic disease management, many of these digital health companies are focusing on two aspects that both Dr. Califf and John Bursler mentioned. One is chronic disease management, and the other is access. And so to me, there is a lot of synergies in thinking about partnerships around both of those arenas. And let me give you an example of what I mean. So in chronic disease management, as many of you all know who are working in the VA, over 50% of veterans about 9 or 10 months after they get discharged from the military are dealing with one or more chronic conditions. So you're dealing with a population already soon after discharge that they are dealing with chronic conditions. Many of them, the way to improve some of those chronic conditions is getting them intertwined into the VA ecosystem as quickly as possible after discharge so that they can take advantage of some of those benefits or services that they have available to them. Some of them, which are frankly not even available to other folks in terms of community services, social referral networks, employment services. The VA is one of the largest employers of veterans, and it does a great job of employing that veteran community. And so thinking about partnerships is how do you bring together this digital health ecosystem, which is continuing to grow, and it will continue to grow even further than that. I don't think we've seen the peak. I don't think we're going to stop at 5,000 or 6,000. I think there's going to be many more digital health companies trying to solve the various different challenges in the healthcare ecosystem, and all of them are coming at it from different perspectives. And so to me, a lot of what we're working on at Chimera, a lot of what we're working on with large academic health systems, as well as large payers and some folks in the pharma industry as well, is how do you start to really bring together these various elements that are occurring in this various explosion that is occurring so that the system doesn't become further fragmented, because that is often the challenge towards access is how do you stitch together this healthcare ecosystem? So if you have a chronic disease management, which allows access for diabetes in some rural part of the United States, how do you stitch that together to that in-person visit that is occurring in that physical hospital system? And, over 50% of veterans, I think the last number from Office of Rural Health or in the VA last year was around 53 or 54% of the veterans that you take care of are not in urban environments, but are rural. And then at least this was pre-pandemic, only about 25% of them, or 25% of them had no access to internet in the home, right? So I think there's a lot of interesting opportunities of partnerships that are really going to accelerate both the deployment of that technology, the stitching together of that technology into a common framework, a common architecture that really allows more radical collaboration. And then and really for the end purpose of what John mentioned a bit earlier, which was access, right? How do you give veterans easier access, better access into the healthcare ecosystem? And aside from just rural veterans, even veterans in urban environments. I remember when I was practicing as a TBI doc in Boston, and I would have veterans driving from Maine to come see me in my subspecialty clinic, right? It's a 4 to 5 hour ride. And so thinking about even in urban environments, how do you make access easier for these veterans that have busy lives, that are working full time? Can you leverage technology if it's stitched together, which requires that public-private partnership, that stitching together to really make it seamless? And when I say public-private, I don't mean just industry or healthcare technology and government. I also mean VA, a lot of VA employees are also at academic institutions. A lot of veterans are seeking some part of their clinical care at an academic health center or a private health facility down the street. So how do you really stitch that together for enabling that veteran journey? I think that's what we're really going to see occurring, and that's the challenge that's in front of us over the next several years, is increasing that that web and that framework so that it's a bit more tightly knit.
Yeah, and I have to say that last bit especially really is echoing what we're learning in the RVH project. Really, folks connect with their communities, their local facility hospitals, and are really questioning, what opportunities do we have to reimagine sort of when and where VA care can be provided. So Sarb, you also brought up a response to my next question. So I'm going to open this up to the entire panel to sort of build on what we just heard. I'm curious, what other opportunities have we seen, or have you all witnessed, or are you thinking about that have emerged out of the current crisis? And how will they, or how could they, transform healthcare in the future?
Well, so I'll take a first stab, and I'll just pick up a bit about, expand a bit on what Sarb was referring to, because I would agree that fragmentation as a general idea is a problem, and it's getting worse. And I would agree too that there's sort of a very big space of opportunity, understanding how to stitch things together. I would take that one step further and suggest that the path to do that is understanding how to create systems that compete with each other. Again, I'm coming at it from an industry standpoint, so my default is always to sort of understand everything from a competitive standpoint. And so, is there a way to integrate? We think less in terms of specific technologies per se, but as markets. And is there a way to integrate markets and manage those markets cohesively, and have those markets oriented on outcomes as sort of the measure of success, if you will. And then, transformation is one of those words that is thrown out a lot. I think it's more interesting to explore transformation from what to what, and I think that's sort of the bigger question. I think personally, from what I've seen in this whole day of fragmentation, I think one of the lessons that have come out of COVID is that healthcare is not separate from the economy. And so how can those two things be brought together and understood simultaneously, and where the orientation is not around cost or price per se, but is around the production of health. And that would be a very different sort of frame if we want to go for transformation.
Yeah, John, help us understand. I'm fascinated by this concept about how competition can actually lead to less fragmentation. And so I want to tease that out a little bit more, because I think that that's really interesting.
So, and again, from the payer and well, even the provider space, and certainly the pharmaceutical space, it's less about point solutions, and increasingly what you'll hear, and especially, and then I come from the world of trying to sell solutions and strategies and whatnot. And what you'll hear now is don't sell me on a point solution. They have too many, there's too many vendors, there's too many technologies, they're too confusing. What they want is that aggregated sort of view and a very efficient way of, and I think Sarb is spot on, of how you can stitch things together, and then how can you manage that fabric so that the performance improves consistently over time, and then it's just a very efficient way of sort of managing that. The fragmentation issue is very large.
Yeah, I can certainly relate with that, and thank you for that clarification, John. That does make a lot of sense. From I would say, from a consumer perspective, I am much more likely to buy into something that can actually play with my other toys than I am to consistently have to get this and then this and then this and then this. So appreciate that. Rob, I'm curious, what are your thoughts on, you spoke of the bright spots, and I didn't really dig into them a whole lot then. What opportunities have you seen that have emerged from the pandemic, and what will they do?
Let me just start just responding a little bit to what John said, because I think there's another, there's an element of fragmentation. I love this term, suboptimization. And that's a business term for when you make your part of the ecosystem better and better to the detriment of the system as a whole. And this is where I think the VA itself is actually a great potential bright spot, because the VA is built to integrate care focused on the patient, whereas the incentives in the private healthcare system right now, I gotta say, it's sad to see it, because people are entirely incentivized to suboptimize, whether it's the pharma industry with now the innovator drugs treating fewer and fewer people at higher and higher prices, or whether it's healthcare systems who are incentivized to find the people with good insurance, so-called payer mix, which really means find the people that have money already. And here the VA is really picking up the needs of the people, particularly rural people, which is where the biggest decline in life expectancy is occurring in the U.S. So I'm a big fan of the VA. I love the discussion too about the academic centers. Most of my career was at Duke, and there's this big place right across the street called the Durham VA, which is a tremendous facility that does a lot of good for people. And so, given that, one of the things that can be done. One thing I wanted to mention, which I've gotten fascinated by lately, is we need to be able to explain things better to people. And a lot of that needs to be in person. But particularly now with the Infrastructure Act and the likelihood that every American will have broadband, I'm very excited about that, obviously. But we're doing a project at YouTube now to improve health information. And I gotta say, when I look at what's on YouTube, most of the really good stuff is really boring the way it's done. That is, as doctors and nurses and health systems, we're not good at producing materials that attract people. And then you have a bunch of people that are selling, more procedures in the private system or something that look pretty glitzy and attractive. So I'm hoping that we'll take advantage of the digital environment to make the stuff that we're doing more appealing to the normal person who is not literate in details of the terms that we tend to use in medicine and healthcare. And so I think that's a huge opportunity. But I think the other folks have already responded to well. There's a tendency, I'm in Silicon Valley. Actually, today I'm in Durham, so I'm in North Carolina. But in Silicon Valley, there's a tendency to think that digital is just going to replace the doctor and the nurse and the healthcare system. That's just baloney. It's really how you put the elements together into a supportive digital infrastructure, which then allows the humans to be less entrapped in filling out forms and more interactive with patients. That's where the real opportunity lies. And, I hope we set up circumstances where the integrative systems like the VA force the private sector to produce products which go to that end.
I love that, Rob. And I'm actually curious, John Bursler, what would you say about there's so much to tease apart there, but I'm really curious about your thoughts on the experiential sort of portion behind how we educate, how we connect, how we advertise, how we engage people in the VA experience at large, right? There's certainly the patient experience, the veteran experience, the employee experience, but just across the board, in what ways are you all thinking about that? And what could it look like going forward?
Yeah, we can't have a world-class customer experience without a world-class employee experience, right? So we are taking quick steps to implement and a lot of the same tools that we have used over the last 5 years to really get to a much better customer experience for our veterans and their families on the employee side. So instead of just having an annual employee survey, which kind of does it's almost like an annual physical, right? We're going to utilize the employee signals platform, which is the same platform as the V signals or veteran signals platform, to do a real-time survey check with a sampling of employees to see what's going on, what are the trends, how can we address different things so that we can make, not only your experience better, but so that you can then focus on the care you're delivering and deliver that world-class experience to your customers. And so if you look at most of the Fortune 10 companies if you look at how big VA is, it's a Fortune 10 company in terms of how the number of people we have and the number of and then the overall budget. If you look at some of the other companies, they all have a world-class customer experience and a world-class employee experience. And then Google and Apple and some of these other organizations that some of our colleagues on the call represent. In terms of like how to engage and acquire new customers, and I think that's what you were asking. If you look at some of the campaigns that VA is using, it is completely the opposite of what I grew up kind of thinking of VA as. So I literally took a picture of a bus here in Washington the other day, and it had a VA banner on the back of it, and it was a young African American veteran, and it looked like a private sector ad campaign to choose VA for care. And it's something that, I just felt very proud in that moment that we're not only trying to engage, younger veterans and like I said, that they trust us a whole lot less, but we're doing so using, kind of the private sector modalities to attract these customers. I also think that the digital environment and the consolidation of the customer experience that VA has really put an emphasis on the last few years through va.gov, instead of having My Healthy Vet and e-benefits and all of these other different platforms, we're consolidating into one digital experience through va.gov. And we're taking it a step further right now, and we're in beta testing with a flagship mobile application that's already out, being utilized by folks that have ID.me or My Healthy Vet or other means of access, DS login, et cetera. And it literally in the palm of my hand as a user, I can access all of my benefits and claims letters and any correspondence I've ever received from the Veterans Benefits Administration, the information I utilize for my education benefits and the post 9/11 GI Bill. I can message my provider. I can check in on appointments. I can find a VA location near me. And best of all, I don't have to log in every time and wait to do the verification checks. I can do a face recognition or a biometric recognition. So I think utilizing and designing for customers and thinking about ease, effectiveness, and emotion, and how that contributes to overall trust, which we know if the more our customers trust us, it leads to better health and economic outcomes for them. The better we can arrive at that world-class customer experience.
John, that is really exciting information that you just shared with everybody. I don't think that many people are aware of the sheer amount. It's difficult to wrap our arms around everything that is happening to help propel us forward. But in a lot of research that the innovation ecosystem has done, and certainly the Veterans Experience Office, I'm good friends with your design directorate, has really exposed just that need for easy to use solutions. If we put something out there and it's not easy to use, what is the point even? It's actually going to do more damage than good. So that is really exciting. I'm curious, and I'm going to open this up to anyone who has an immediate response, and then to build upon each other's ideas, bringing it back to innovation, like what John was just saying, what we've been bringing up, related to trust. This past year and a half has really laid bare a lot of vulnerability, especially for people who are in already vulnerable positions and circumstances. And trust is of utmost importance, and it can be really hard to come by if we don't do our due diligence and really invest in outreach and relationship building. How does innovation tie into trust, and how can we use and or develop innovations to help build healthier, stronger relationships with our patients, their communities, and everybody who's involved in taking care of fellow humans.
I'll start off the group and say, I think some of the items, threads that have already been said, especially from some of the elements that John Bursler just said regarding experience. I think trust is really knowing, as we all know, it's built over time and it can be lost very quickly. Just one bad experience incident makes you lose trust in an entire system. And I saw that in my time when I was in the VA, reading a lot of the voice of the customers, reading a lot of what our veterans were feeling, going out there, speaking to veterans groups. I think that is a piece that focusing, trust is an outcome of the elements that you put in. So you can focus on trust, but what's probably better is to focus on all the elements that are encompassed in that experience that build a high trust, high reliable, high repeatable, all the other elements. And then just like, and again, I maybe put on my quality and safety hat from before, many of the elements that we track in quality or patient safety are outcomes metrics. But what you really need to also focus on are the inputs, and what are the inputs that built a high trust experience. And so I think, a lot of the elements that VA is in the journey that they're on, that they've been doing the last several years, is enhancing and building upon that trust, both for the veterans as well as the employees. It's better knowing their veteran population, better being able to serve that veteran population. And so when you think about innovation, that to me, the intersection is starting with design, starting with some of the basic elements of design thinking, starting with some of the basic elements of experience, really getting to know the customer, the veteran population. There is a lot of great work that has been done in terms of thinking about not just the veteran, but also the caregiver support system, since that is so important in that veteran population. So focusing on a lot of those inputs and putting that into your innovation pipeline, rather than, I think, Rob mentioned this earlier, rather than just starting with just the technology, right? The technology will come, and with the technology explosion that we have now, there's probably tech solutions for various aspects of everything that we want to do. But the way you stitch it together in the right way is starting off with, what is the experience you are trying to deliver? How are you trying to make that experience seamless? And I'll give you an example from one of our large academic systems that we're working with to integrate a lot of their different data systems, not just clinical data systems, but thinking about they do a lot of social referral work with FQHCs, federally qualified health centers, in their communities. That data doesn't integrate into provider workflow or patient workflow, and their patients are flowing between the FQHCs and between these large academic hospital systems. One of the things we talked about in our recent visit was they're also very co-located with a large veteran hospital system, and all of those satellite clinics that come with that large hospital system in an urban environment from the VA. And there's not a lot of data exchange or data transfer. And they were actually wondering, some of the veterans that we see may have other services that are available to them that we don't know how, we can't prescribe it as they would be able to prescribe if they walked into the walls of the VA. So how do we get better intertwined access for that seamless journey to occur? So I think thinking about trust, going back to your original question, and trust and innovation, I think starting off with that design process, understanding that ecosystem that the veteran is and their caregiver and family member is really trying to navigate, and then aligning the experience around that, the outcome of high trust systems will be built upon that.
Well, I feel like maybe I should focus on three things quickly. The first that we've already discussed is don't depend on digital to build trust. It's a human thing. The second is I really like what John Bursler said about paying attention to the workforce, because since it is a human thing, essentially trust is built by people interacting with in the case of the VA, interacting with the VA system. And that's got to go well if you're going to build trust. I think there is a real problem in our society today with leaders saying one thing when the truth on the ground is something different. And slogans and nice statements are good to have, and it's good to see the leaders are committed verbally, but the real experience that people have is what drives trust. And so then that gets to the third thing, which is you got to be as clear as you can about what you can do, and then make sure you do it well. As simple as that sounds, I think that's critical. And I'll just add to that an element that has mystified me, but I think I'm understanding it better as I'm working on this YouTube project, which I'm not in charge of, but I'm getting a chance to really learn from it. It always mystified me that the VA did a better job with chronic disease management, evidence-based care and outcomes, usually than the private sector, and there are academic papers that demonstrate that, but no one seems to know it. And so I think one of the key points here is, in addition to doing it, we have to talk about it honestly and up our game a lot in letting people know the good things that are being done.
And reinforce the idea of a consumer grade experience is an organizing idea, again, for how industry is looking to compete and how industry is looking to maintain continuous health engagement. I think that the idea of government as innovator, and even VA as innovator, and VA focused as they are on the experience, is a radical shift in sort of the entrenched way that I think people historically have thought about the VA.
Yeah, I would agree with you wholeheartedly on that, John. And John Bursler, I just saw that you came off of mute, so I'm curious what you have to say. I'm going to stop talking.
Yeah, absolutely. And so, as the steward of all of our trust scores, one thing that when we presented a lot of this information to Secretary McDonough early on in both of our tenures, his immediate thought was we have to be transparent and hold ourselves accountable. And there's no better way than to publish this data on a more routine, consistent public basis. And so we did just that. And for the first time, we built a trust website to actually use as a barometer. So it's just va.gov/trust. And we did a media tour and really kind of explain the why behind these trust scores and how we arrive at it. I mean, with the 3 E's, was it easy to navigate the VA facility and find where I needed to go, or even park to go to my appointment, or meet with my VSR on the benefit side to talk about my disability claim? Was my care effective? Meaning that, did I understand what my provider told me about my appointment, or did I understand what the Veterans Service representative told me about my claim? Emotion is the 30. Like, did I feel respected in that encounter? And do I trust VA to continue to deliver that care, or the level of service and for the benefits that I'm trying to attain in a respectful way? So all of that kind of pours into our overall trust scores. And even though they've gone up 24 points in the last 5 years, we still have a long way to go, I think. So our current enterprise-wide trust score is at 79%, which, if you look at a lot of other big companies that's pretty good. But we want to get but that's still like a C, right? I think that I'm not really sure that was usually my average in school, 79, and that's a C, right? C plus. But we want to get to an A, even if it's an A minus. We want to get to 90% in the next few years, incrementally, by allowing a lot of the tools and implementation to take root at the medical center level, at the outpatient clinic level, so that we can improve that overall customer experience and hear from those customers on what they need and how we can provide for it. I think back to the other question, and I'll turn it back over after this, is in terms of opportunities, and something that we've talked about in the innovation ecosystem here at VHA, and what a lot of us are a part of, is the ability to tie in more effectively with the channels and the organizations that provide and address the social determinants of health, that lead to better health and economic outcomes. Because if VA provides and delivers these three services very well, but the veteran and their family and their caregiver need D through Z, the D through Z is provided by local and state government, nonprofit organizations, or even private sector organizations. How do we better tie in? How do we arm our clinicians, our frontline care providers, our social workers with the ability to refer into food assistance, financial assistance, legal services, employment, so things that will actually allow the veteran and their caregiver to come back and go to their next appointment, because they can put food on the table, they can put gas in their car, they can get to that next bus stop. So lots of opportunities to address the social determinants of health as we approach a more unified customer experience using technology, but understanding it from the human perspective.
Yeah, and John, that is so important to bring up, and we've gotten to this in a couple of different ways. It's not, as Rob said, it's not all going to be technology. A lot of this is about humans. I think that quite a bit can and should be related to policy change. And I'm curious about what you all might say in thinking through, our topic here is forging a healthier future. Post-pandemic care. So this idea of health and trust, and the current model, even though the VA financial model is quite a bit different than what you might see in other healthcare settings. In what ways do you see policy change, or even laws helping to move us from this current model of sick care in many ways into true healthcare, preventative medicine, holistic medicines, allowing people to truly thrive and be well instead of being treated episodically or managed for chronic diseases. How does the pandemic as an inflection point help us think of a future where that is the standard, where that is the norm, and the Department of Veterans Affairs is who is leading us?
Well, I can't resist being a bit of a curmudgeon here and just say, if we look at what's happened during the pandemic to all other aspects of health, it's not a pretty sight. We have record levels of distress in terms of mental health. We have a rapidly escalating drug overdose death rate in this country, very high suicide rates, and sort of an arguable amount of weight gain. But I think most people believe there's been substantial weight gain during this time. And in addition to everything else, when it comes to trust and customers, one of the problems with preventive healthcare or preventive behavior is that a lot of what you need to do to prevent chronic disease or to deal with chronic disease doesn't feel as good in the short term as doing the opposite. I always use the Bojangles example when I'm in North Carolina. I love Bojangles biscuits. They're fantastic. And, my doctor says, don't eat so many, but man, it tastes good. So, but I think the ability to reach people constantly by digital methods and provide nudges and support, and then optimizing that human part, we come back to the same thing. People need to be supported. And, it's just logistically impossible to think of having a whole team of people constantly around the patient where they're living, but with a digital infrastructure. And then this very important, many of you have referred to logistics, just getting the right routing for community health workers and people who go into the homes could make an enormous difference. And I think we're well on our way on that.
So Rob, I always appreciate a good curmudgeonly answer, especially when it's pretty spot on. And I've never had Bojangles for the exact reason that you mentioned. I'm afraid I would love it. Does anybody else have a response to that?
I would suggest that when we talk about industrial policy and we talk about reorienting how we even measure economic production, and thinking about, do we need to shift from GDP as a measure, and do we need to shift into where the conversation and the narrative and the policy innovation is one that enables a completely different economic framework that's centered on the production of health. It's a very different sort of idea, as one that looks at cost and looks at measuring the pieces and the parts. It's do we need a completely different economic and industrial policy and a completely different way of understanding how to measure the production of health and to incentivize that.
Yeah, wow. That truly is a vast departure from our current known. So thank you for that, John. I want you to tap into your personal journey over the past couple of year and a half, certainly through the pandemic, more so than your professional viewpoints. And I want to talk about this idea of orthodoxies. And I think that the pandemic, from everything that I have experienced personally myself, this has really shaken a lot of these personal orthodoxies that I have deeply held for many years, as well as a few of my professional. What have you been questioning related to these deeply and profoundly held beliefs or assumptions that you have had about the way things are, or the way you are in this world? And what do you encourage other people to start thinking about related to their own assumptions or orthodoxies?
And I'll take a first stab. I think it's what for me has become acutely aware that it's not about me, it's about we. And I think what I'm finding, the critical need to find a way to unlock the we, to borrow a phrase, is paramount. And I feel challenged and I guess frustrated, because as big a need and as big a shift as that is, we seem to be moving in the exact opposite direction and are confronting globally extremely serious issues that need just a very different sort of collective effort that currently doesn't seem to be happening anywhere.
Yeah. Thank you for that, John.
I'll take a stab at this as well. I would say it reaffirmed how far we have to go in the healthcare ecosystem in the United States to truly get towards what you were just even talking about a few minutes ago of well care or preventative care. I think, for a period of time in the early part of me practicing medicine and talking to patients, talking to family members, I got to a feeling that, yes, there's a lot of great activity occurring in the healthcare ecosystem. When you see all this positive work that's being done in the healthcare ecosystem, not just in VA, but outside of VA, just broadly in the United States, you think that it's all heading in the right direction. But what we really saw in this pandemic is just more stitching together of that is needed of this fragmented ecosystem that we have. And that was just me as a practicing physician. I thought that, I knew we weren't perfect, but I didn't realize how far we had to go to really stitch together that patient experience and that member experience, that veteran experience. So I think that's one of the things that was enlightening to me. And then a lot of the teams that I've worked with that are not frontline caregivers or frontline care team members, but are more on the administrative side of hospital operations or payer operations. What I really saw was a shift also in their mindset to be much more energized about the healthcare ecosystem that they're working in than I think they felt pre-pandemic, where they maybe felt like they were a cog in the wheel of the healthcare ecosystem, but not really vested in healthcare delivery because they weren't the last mile of healthcare delivery. And I think I really saw a shift in that with a lot of my coworkers, which is frankly good to see, and a lot more energy in terms of how do we solve for the challenges of healthcare and truly try to get towards population health. And I think that, on a high note, VA is really well positioned to be able to drive this for many reasons. One, which was mentioned already, is just because of its sheer size and footprint that it has in terms of care delivery in the American healthcare ecosystem, which I think many people forget, that it's not just the pillar of healthcare delivery, but research, education. So there's so many different aspects of how VA can enable that. And I think those are the elements that I've seen shifted over this past year for me.
That, my friends, I think is a beautiful note to end on. And I want to take just one more moment to thank our panelists, John, Rob, Sarab, John. You all have been a treat to speak with today. I thank you all so very much for joining us, of course, and for the work that you do every day to help make the landscape for healthcare in the United States, and arguably, globally, better and better with every day.